load, and he was doing a lot of prescriptive writing that I wouldn't have thought to do. And it really melded the two worlds together, because I was focusing more on naturopathic treatments and more on, really leaning towards into that side of medicine. But after starting with his patients, I realized that, there's a very tremendous work that goes into conventional medicine and antibiotics and these conventional treatments that are really, the kind of standard of care in medicine. And now medical doctors are going to conferences and getting certified in integrative medicine. And what they're really learning about is naturopathic medicine, which is outstanding, because now we've got a very large group of physicians that are looking not just to the standard of care, but outside the box. And you're looking at what works for each patient and trying to really fit the patient rather than fit into this protocol that was specific for a condition.
Right. I think that's a great explanation too, just because a lot of people associate naturopathic medicine with just natural treatments, right? Or conventional treatment with just allopathic, and having the best of both worlds, I think is the best combination. And knowing, just because the average American is on pharmaceuticals, at least one or two when they typically come in. And so knowing how to deal with that, how to balance that, and what herbs, I think that's a great way of explaining integrative medicine and what you do there too.
Yeah. And just very generally, it's just using what works. And because naturopathic doctors were trained in kind of all of the things, but not specializing in one particular one during school, but because we were trained in all the things, we can have the opportunity to use more. And, I've done training past school in a lot of different areas that I like to focus in on, which are more my specialties. But I love the integrative part of it, because some patients come in and, they don't want much conventional stuff. And some patients come in and they don't want the other side. So it's, you have this really broad spectrum of things that you have the opportunity to use in your toolbox. So I love it. And I don't think I would practice another way.
Very cool. Very cool. I love your clinic too. I think it's amazing. It's beautiful, and it's the perfect balance. The perfect balance there. So I will move on.
I need you to come back so that you can be here.
I know, I'd love to soon. Someday.
Yeah,
I'm working on it.
Soon.
So you have a very impressive background, especially in both medicine and nutrition. So how do you integrate both of these two into your clinical practice as well?
Well, so I did things a little bit backwards. So I got my master's actually after I got my doctorate, because in the naturopathic curriculum, we learned a lot about supplementation with vitamins and minerals and amino acids and nutraceuticals for condition-specific reasons. And so we were taking somebody that had, whatever issue going on, and then we would give them things that would help to manage that on a physiological level, right? What I wanted to do is simplify it a little bit and make it a little bit more accessible for me to be able to tell every single patient about what they're putting in their mouth. I wanted to be able to look at their plates, or, virtually look at their plates, and be able to tell what they're missing and what there's too much of, and really be able, kind of on a therapeutic level, to talk about food with every single person, because it's basic. You have to eat every day. And so it's something that I can talk to every patient about, and we can talk through what works in their life as far as, their diet goes, not specific diets, but there's so many trendy diets out there. Everybody's always trying something for either weight loss or how to feel better. And it's nice to be able to talk about it on a way that isn't just, therapeutic, but also like daily life stuff, how you can incorporate more green vegetables into your diet, or if you're eating way too much protein, backing that down and supplementing that with, more carbohydrates that are really good for you, lots of leafy green vegetables and fruits and things like that. So for me, I really wanted to have the option of being able to not just do therapeutic intervention with nutrients, but also the daily what you put in your mouth kind of stuff. So it made a lot of sense, even though it was really backwards. And I was actually the first naturopathic doctor to get a master's in nutrition as well as the registered dietetic degree. And it was the first year that Bastyr had offered it. And it was kind of, it was interesting, to say the least, to get all the classes, put in the right spots. But we figured it out and we did it. And I actually did my dietetic degree. I did my internship afterwards in Santa Barbara through Cottage Hospital and also through Cal Poly. So that was an interesting experience. It kind of expanded my horizons about the whole nutrition world too.
Yeah, especially in the hospital setting as well.
Yes, which is very different.
And also, I think the hardest part about nutrition, especially in clinical practice, is getting patients to follow through. So all these little things you talked about, like the easy things to implement, I think make the biggest difference to actually get them to continue.
That's the hardest part, the compliance. Like, you can talk about it and talk about it and talk about it, but especially, moms who are feeding kids, whatever food they're eating, mom doesn't have enough time to make her own meal, and like figuring out ways how to do that and practicality stuff. And it's fun because every time I sit down with somebody, I talk about it. So anytime anybody comes in, we're constantly talking about ways that we can do better, because no one has a perfect diet. But to do what works 80% of the time, it just makes such a big difference in health.
Definitely just those little things, for sure.
Yeah.
So I'll jump into the next question. Our favorite healing modality here at Puriya is botanical medicine. And I know that you love it as well. I can see already just in back of you all the amazing herbs and everything.
Yeah, so there you can see like all my apothecary full of all of the herbs.
It's beautiful. And I love that you incorporate that into all of your patients too, because it's such an amazing modality, and it's perfect that you're on the science board with us and you can share your wisdom and everything as well. So tell me a little bit about this apothecary and what you do, how you treat patients with what you have here.
So like, I would say 5 years ago, I really wanted to get back to using more plants instead of like herbs in a supplement form. I really wanted to be able to get patients to use things, I've always used tinctures, which are, the alcohol-based botanicals, but I really wanted to be able to have the option of creating formulas specifically for patients. And so I did a little online course, kind of an herbal medicine making course online, which was a lot of review from naturopathic school, but it was really more about remembering all of my herbs and remembering what synergistically goes well together. And I started making teas for patients. And I think for me, tea is a really good way to introduce healing plants to patients, because one, if you're making a tea every day or twice a day, you are really actively participating in your therapy, which I think is amazing. Most people need to have a moment to sit down from their day and just be able to relax and just take a minute. And having to make a tea is really nice, because in a way it kind of forces you to take that moment and sit down and really taste your medicine. I feel like I say it all the time to patients, and a lot of the herbs don't taste very well. So
Yeah.
the patients are like, well, that's all good and well that you like to taste your medicine, but it's awful. So let's figure out something else. But I just have this really strong belief that if you're tasting your medicine, then the effectiveness has increased. And I try to make the teas really pleasant. I don't try to make them taste bad, but I think that that's kind of a really good like initiation into the botanical world, and it offers a lot of flexibility because I have patients, like for example, I see a lot of women, and I have patients who are sensitive to particular herbs that might cause them to have a hot flash or might cause them to have some hormonal symptoms that we don't want. And so I can really formulate specifically if they have allergies or if we're going for, really gentle transitions in their system, then I can kind of use all of my resources and make them whatever I need to make. And I have, if you look kind of at the top shelf, I have lots of tinctures, and I formulate tinctures for patients as well. So again, you can do that on a different level if someone doesn't want to have the opportunity to drink their tea if they're really too busy. And we can make up a specific tincture so they can just drop it in their mouth or drop it in some water and go on their way. But really doing the tea, it's my preference. I make poultices for patients and all kinds of other stuff, but teas are just, they're easy and they're fun, and most patients really like them.
Yeah, it's like it creates a ritual in their day too, where they have to pause, they have to relax for a second while they're doing it.
And they can even do other things like breathing exercises, or do a little journal entry during the same time, which is kind of nice, so that they can have that moment to themselves.
So when you make teas, like what do you typically focus on, or is it just so individualized during the day too? It's somebody needs to relax, then you mix a formula for them, or if they have anxiety.
Yeah, it just depends. Like I said, I see a lot of women, and so hormonal teas are pretty big. But sleep, I have a sleep formula that I make up that every time I make a big batch of it, we put it on the shelves, and it like the next day they're all gone. So I have to make them pretty consistently because it's a really good formula. It's gentle. It doesn't knock you out for the night, but it kind of just helps you to transition into that sleep. And that's one that kind of everybody likes. I have a Zen formula that I also make kind of just as a generic formula that people love because it's just super relaxing, and you can kind of take it at night and just kind of wind down from the day. I have some anti-anxiety formulas, but mostly it's particular to the patient, to what they're really needing. I have, I make a lot of liver teas, milk thistle and burdock, and doing lots of different things. I have digestive teas for people that are really having some digestive issues, and usually we'll combine it with other therapies, but it's super personal. But there are those little specific ones that, like the Zen and the sleep tea, that people just, they love.
Yeah. I mean, just the power of botanical medicine and how many different tools we have, from like nervides and carminatives and all these great things to work with. It's incredible what you can do, definitely on an individual level.
Yes, exactly.
So I will jump into my next question. This is the question I ask every doctor when I do this series, and it's more about your personal philosophy. So I think that how a doctor practices and how they view medicine and the disease is really important, and it shows a lot in what they do. So, and maybe this is because I lived in Greece for so long and we talked so much about philosophy and everything there, but I think it's so, I think it's just a core element, especially in naturopathic medicine, of how we're different and kind of the foundation of it. So tell me a little bit about your personal philosophy on medicine.
So it's a really good question, because it's not something that I often think about. It's just, kind of in me all the time. So I think that the core, one of my really core beliefs is that if someone has an unwell feeling, or if they have symptoms, or if they have a condition, the body doesn't name that condition. We as humans have named, diseases and conditions so that we can keep them in categories and understand them better categorically. But I feel like with my philosophy, it's more about just really looking at something from a whole health standpoint. Like, what are the cells doing? What's the function that, what is your body trying to compensate for? Or what's the underlying cause that's out of balance that your body's really trying to get back into balance and compensate for in a different way, which generally is what causes symptoms. I have people that, most people come in after going to many specialists and doing lots of research, and they have a condition that it's just not resolving. And so they've been through lots and lots of testing, but it might not be the testing that is getting down to the core of the dysfunction in their system. And so they'll come in with a diagnosis of whatever. And that diagnosis it's great for insurance purposes. It's good for them to have a name to what's happening. But for me, it's more about looking at physiology, looking through the biochemistry at what's missing, or what's excessive, or what's happening with each particular function that is causing this disease, and then really treating it in a way that's going to be the least harmful, and getting them to feel really optimal from that point. So in a nutshell, I think that my job is more as an investigator. And if I can put together the pieces of the puzzle and come up with some really kind of core dysfunctions, and we can start to really help those to shift to a more optimal functioning, then that's when we get the wellness that we want.
I love that. I think it's very well explained, especially since you said you didn't think too much about philosophy. So I think you have a very intense philosophy on looking at the underlying conditions rather than just the symptoms or labels within it. And I think that's where healing really begins too, in that. So that's very important for sure.
Absolutely.
Okay, so I will move on to the next question here. We are very excited to have you on the Science Advisory Board. I'm extremely excited. I think it's going to be a lot of fun to get your knowledge when we're formulating and helping put things together. And you have a very interesting background too, because I know that you've been studying and doing additional training as well in skincare.
Yes.
So tell us a little bit about your knowledge there too. I think our viewers would be very excited to kind of hear about your background in that as well.
So, like we said earlier, lifelong learners, right? I'm constantly
it never ends.
More things, but like probably 3 years ago, I started really becoming interested in skincare, and I would look at products, and there was so much stuff in lotions and soaps, and there was just too much. There was just too much going on in the formulas, and I thought, well, I can make this myself. I'll just make it myself. And so I did some like DIY Googling, and looked on, like, Mountain Rose Herbs is one of the places where I get a lot of my botanicals, and they have a lot of recipes for body butters and all kinds of stuff. And I started making, and I wanted to make, like, my goal was to make the perfect body butter, and then to, make some face oils and things along the way. And I did it for about a year, and then I was like, I'm not doing this very well. I never got like the perfect body butter. And so I found this company, Formula Botanical, that's in London. And they have these great online certification courses. One is I'm taking the organic skincare formulation and organic cosmetic science, both of those certifications. And basically they just are teaching me, one, specifically how to formulate, but also the science behind the formulation and how you do it in a way, thinking about the chemicals kind of like we would think about the chemicals biochemically, things that happen in our bodies. So it's been super fun. I don't always have time to do it as much as I want, but it's been super fun to learn about how to make lotions and what to put in and what to put together. And I've had lots of formulas that did not work very well. And I've had some that have worked really well, which has been nice. So it's been super fun, and I love doing it, and which is why I loved you asking me about the science board, because it's totally up my alley.
Yeah, it's a perfect fit, and it's interesting. That's kind of how our company was originally founded. Was one of the owners had eczema, and she didn't like anything that was out there conventionally or naturally. It didn't work, and so it was kind of like trial and error until it came to a whole new level where she really started studying it, and then it became what it is today. But it started kind of from that need too of like, hey, wait a second, I can create something that's better,
right,
more effective out there. Yeah, that's natural.
And if you ever there's a little shop here in Santa Barbara, and I just walked in the other day just to see, they carry like tons of lotions and skincare stuff. And it's amazing, like the things that they were saying, oh, this works really great, and this one is perfect. And I mean, I thought after doing the formulation courses that I would be able to recognize a lot of the ingredients, and it's chemicals, and once in a while you'll get aloe or shea butter or something that you recognize, but most of it is just, they're chemicals that aren't used in organic skincare, which is so interesting because our skin is our biggest organ of elimination. So, you want to put things on it that your body absorbs that are really good for you, and, that your body doesn't have to detoxify you from. So I think it's pretty important. And like I said, it's been super fun to learn about it too.
Yeah, I know. It sounds very fun that way. I've been definitely learning about formulations. I'm more on the supplement side at this point instead of the skincare side, but yeah, it's a lot of fun, just the whole process for sure. Okay, I'm going to ask you the last question, and it's a perfect question. It's, what are your top botanicals for skincare and why? Which is a tough one because
there's so many. Okay, there are just so many. I mean, you have to say calendula because calendula is good for everything. I mean, it's anti-inflammatory, it's super soothing. Anybody that's got sensitive skin, I don't know anybody that's ever had sensitivities to calendula. It's just one of those things that are like a base botanical in formulas.
We use it a lot too. Yeah. It's a good one.
But then I also like things that help with collagen, like hawthorn. Like you think about hawthorn internally as this wonderful heart remedy, and I use it a lot. The berries are somewhere right there behind me. And it's lovely and wonderful internally, but it promotes collagen when you put it in a formula, and it makes the formulas look pretty. Like if you do it in a facial oil, if you macerate it in a facial oil, it makes everything a little bit red, which is lovely. And then there's I've just started using dragon's blood, which comes from a tree in the Amazon, and it's amazing. I mean, it's got so many like anti-aging principles, but it also promotes collagen. It helps healing wounds, which is kind of amazing. So that's one that I use. I've been using. I learned about it kind of a while ago, and I've been using it more and more in formulas. And then there's all like the base oils that are so healing, like tamanu oil. I can't even tell you a principle that it doesn't have. Like it's antimicrobial, it's anti-inflammatory. There's so many things that it does so well. It's super healing. And all of the oils that I use come from a tree or a plant or a seed. And it's like there's all something super medicinal about every single one. And I've been actually trying formulations or trying new oils from the Amazon, from Peru. And it's incredible. Like the formulas that you see in America are mostly based in mango butter or shea butter. But I mean, like muro butter is amazing. And it comes from a plant in the Amazon. And the healing potential of it is just incredible. It helps with collagen. I mean, there's so many things that it helps with. And I know I've listed way too many to be my top, but there are so many things that are just like rose hips are great because they're antioxidant. So they're great in like face formulas, but they're also really high in vitamin C, and they help with collagen too. So that's a hard question, but there's so many, which is pretty incredible because we have so many things to choose from, and they're just zillions of ways that you can put things together and make incredible formulas, which is what I love to do, and which is great about these products that you guys are making too, because they're very condition specific, but they've got so many incredible plants in them that you just can't go wrong.
Yeah, we're releasing our new formulations probably in a couple months. Maybe it might be a little longer because it always takes a little bit to get things going, but we've taken them to another level. So I'm very excited about that too, with different botanicals and different things that'll be coming out soon. So that'll be exciting.
That's exciting. Well, I can't wait.
Yes, definitely. So I will let you go soon to your patients, and thank you for taking the time. But can you tell us where you practice and anything you have going on, any upcoming events to kind of let our viewers know and get to know you? Because I'm sure they're going to see you in the future too. Yeah. It's a great introduction.
Yeah, so I'm in Santa Barbara, California, and we're right downtown. And we actually are transitioning the space so that we can have more community events, women's groups, and more open houses. There are so many new CBD products that I'm kind of doing a big investigation on kind of the different companies and how we can utilize those the best, because
excellent.
I think, CBD is it's something that has a lot of potential for medicine, but not very many people know about it. So we're going to do some kind of CBD pop-up things and try some new things with those. And I actually have a new project where I'm working on bitters. So I'm formulating lots of different bitters to be used medicinally, but also, for in food and beverages as well. And so we'll be having some events around kind of introduction and education on bitters as well.
Lots of fun. Well, a lot of our viewers are on the West Coast, so I think that's perfect. So they can get to know you, and you're close to them in California too. And it sounds like you're doing a lot of really exciting things. I wish I was there and I could go to these events too myself soon. Someday soon.
Someday soon.
Well, thank you so much for meeting with me today and getting to our viewers to get to know you too. I'm really excited about that. And we will have you on the show again soon. In a couple months.
Thank you for having me. I love seeing you.
Yes, it was so good to see you too. We will catch up again. But thank you. Have an amazing day too.
You too.
See you later.
Okay.
Bye.
Bye, Michelle.